you're good.
Thank you, Abby, and thank you everyone for having me here. I had the opportunity to talk to this group last year, and it was a real pleasure. And I hope people got a lot out of the presentation. So I was excited when you asked me to come back this spring. So we're kind of going to be doing a recap or a repeat of what we did last year, but I changed it up a little bit. So just to give you an overview of what we'll be doing. I'm going to talk first about some information regarding sleep, some background education about what sleep is and how it's regulated and what sorts of things interfere with sleep, and what behaviors we can work to achieve that help to regulate sleep in a healthy way. And then I want to leave some time for questions, because oftentimes people have questions about sleep and what they can do to improve their sleep. And then at the end, I wanted to leave some time to do a relaxation exercise with everybody that can be really effective in helping to initiate sleep if you do it on a regular basis. So I'd like for all of you to leave here today with that exercise. And if we have the recording, then it will be available to people going forward as well. I'm sorry, Abby, I forgot to introduce myself again. I got off on the races. I'm Matt Iwaniec. I am a clinical health psychologist. I work at West Bend Hospital at Allegheny Health Network, primarily in the Cancer Institute there. And my work primarily in the Cancer Institute is with hematology oncology and with stem cell transplant. So that tends to be most of the patient population that I work with and most of the work that I do. But I have worked with people with other forms of cancer throughout my working years and throughout my training, but that's my area of specialty. So let's talk about sleep. Looks like we're skipping a slide, so let me back up here. So why do we sleep and what happens when we don't sleep? It's not really clear why we sleep. There's not a clear, definitive biological reason that's known to science about why we sleep, in the same way we know how the heart works and how the lungs work and what the digestion system is for. But there are some ideas about what sleep's function is. We know that it's necessary for survival. We know that it's necessary for healthy living. We know that it causes a lot of problems when it's not going well and we're deprived of it. But aside from that, these ideas about why we sleep are just sort of hypotheses at this stage. So one idea is that sleep allows our brain to clear away metabolites and toxins that have built up during our waking hours. Because as the brain functions, it accumulates a lot of metabolic chemical side effects that just kind of sit around in the brain that need to be washed out. And this happens, we know, during the sleep portion of the day. So we think that sleep might be necessary for doing it. We also know that sleep restores energy reserves. So we feel very tired when we don't get it. We need rest at the end of the day, and sleeping allows us to recharge those batteries. What we know from a psychological perspective also is that sleep is the time of the day that allows us to consolidate our memories and consolidate what we've learned throughout the day. So if we're not sleeping well, our memories tend to be poorer, and we tend not to learn discrete information that we've encountered during the day. We tend not to learn tasks that we've encountered during the day. We really need sleep in order to learn and remember what we've been doing. So these are all purposes for it. Whenever we lack sleep, I mean, we've all been in a situation where we lack sleep. So I've got a 1-year-old, so we haven't slept well for the past year. And she kind of goes through phases where she sleeps better and phases where she doesn't sleep well at all. But I have encountered a lack of sleep like at no other time in my life. So I know it's affected me in all of these ways. We experience concentration difficulty when we don't sleep. And part of that is because the brain is just not working as efficiently as it does whenever we have that restorative sleep period. We know that we feel fatigued. And fatigue can be both a result of sleep problems and contribute to sleep problems. And fatigue is such a huge part of the cancer experience, whether it's chemotherapy or it's radiation. To echo what was said earlier, radiation can profoundly cause fatigue. So some people think, well, if you're really fatigued, you must be sleeping well. No, not often the case, for reasons that we'll talk about later. But when you're not sleeping well, it does contribute to the fatigue. As I mentioned before, it does cause problems with memory and learning so that we're not thinking clearly. And whenever there's a chronic lack of sleep, this can be associated with health problems. And I emphasize chronic because if you miss one night of sleep, if you miss several nights of sleep, this is not going to lead to chronic health problems years down the road that we often hear about in popular health culture. Like if you're not sleeping, you're going to have heart problems. If you're not sleeping, it can cause cancer. If you're not sleeping, it's going to cause problems with your digestive system. If you're not sleeping, it's going to cause problems with allergies and with what's the other one that comes up? With your immune system. So there are all these ideas that if you're not sleeping well, you're going to have all of these problems. And that's true when there's a chronic lack of sleep. So it's going on for years and years and years. But just missing one night or having a bad week is not necessarily associated with those chronic health problems. And I bring that up because I've had people in my work say, I haven't slept well for years. I did nothing to address it, or I was working too hard, or I had too much going on with my kids. And does this contribute to my cancer? And then there's a lot of feeling of guilt and shame and regret associated with that idea that because they weren't sleeping well, that this led to cancer. So the research really doesn't find an association between most types of cancers and sleep problems that occurred before the cancer diagnosis. There's some association with colon cancer, lymphoma, thyroid and stomach cancers, some associated with bladder cancers, but they're very weak. So by no means is having chronic sleep problems a cause of cancer. What we do know is that when you do get cancer, you have sleep problems. And the research says that it's estimated that about 50% of people with cancer have sleep problems. I'm kind of surprised to hear that statistic because everybody that I know that has had cancer and everybody that I work with on a therapeutic basis that has cancer or has had cancer has had sleep problems. And that's for a variety of reasons. The cancer itself, the medications, the chemotherapy, the radiation, the fatigue that comes with it. It is just so common for people who are experiencing cancer to also experience sleep problems. And then we get this concentration difficulty, we get this fatigue, we get problems with memory, we get problems with learning. And then this leads people to worry, why am I not thinking clearly? Am I also developing some sort of dementia? Why can I not think straight? And it all kind of gets bound up together into a lot of anxious thoughts, a lot of anxious beliefs, a lot of anxiety, and that's just really not helpful to people. So what I want to do here is give some people some information about sleep, why it's important, and the limits of its importance. So sleep is regulated in a few different ways. So the two ways that really regulate it are the homeostatic sleep drive. So that's the first thing on this slide here, and the circadian rhythm. Now, most people have heard of the circadian rhythm, but nearly no one has ever heard of the homeostatic sleep drive. So I want to give you some information about those. So the homeostatic sleep drive is a really fancy way for saying that your brain keeps track of how long you've been awake. So the longer you've been awake, the more primed you are going to be to sleep. Your brain has an internal clock, not the circadian rhythm, but another internal clock that keeps track of how long you've been awake. And the way it does that is it keeps track of how much adenosine is in your brain. So this is the little chemical that builds up in your brain the longer you're awake. So the longer you're awake, the more adenosine you have. The brain can detect that. So it knows you've got a lot of adenosine, it's time to sleep, or you don't have much adenosine, and it's not time to sleep yet. So the level of adenosine and the homeostatic sleep drive that is part of that is affected by two things. It's affected by caffeine, and it's affected by napping. So caffeine as a chemical, when it gets into your brain, what it does is it binds to the receptors in the brain that bind with adenosine. So when caffeine is in the brain, it blocks the receptors, you know, in the same way that kind of putting a mitten over your hand would block you from grabbing something. The caffeine blocks the receptors from grabbing onto the adenosine. And then it thinks that there's a lot less adenosine in your brain than there actually is. And when the brain thinks there's less adenosine, it wants to stay awake. The other way that the homeostatic sleep drive is regulated or affected, rather, is with napping. So remember I said, the more time you spend awake, the more adenosine builds up. So if you take a nap, you're sleeping. And when you sleep, as part of that nap, it starts to clear the adenosine out of your brain. And when the lowers of adenosine decrease, now the brain thinks it should be awake and it doesn't want to go back to sleep. So if you have a really long, good nap in the afternoon, it's really hard to get to sleep at your normal bedtime. Like say you go to bed at 10 or 11, but today you took a nap for an hour or 2 hours. It's really hard to go to sleep at 10 or 11. So this napping and caffeines affect the homeostatic sleep drive, and that affects the amount and quality of the sleep you get in the evening. Now, the other regulatory system that's internal to us is the circadian rhythm, and most people have heard about that. Now, this is regulated by light, and rather than telling your brain how long you've been awake, what it's telling you is the time of day that it is. So as your eyes detect light and the brain is exposed to light via the optic nerve, it's telling your body with the circadian rhythm that it's waking time, it's daytime, I should be awake. And the part of your brain that does this is called the suprachiasmatic nucleus. So it's this little piece of your brain that when light is detected, it fires. So it's like wake up, wake up, wake up, wake up, wake up, wake up. It's not time for sleep. Then as the day gets darker, the suprachiasmatic nucleus isn't firing as much. So the brain is now starting to move toward its sleep phase. And this is biological. This is genetic. So some people with circadian rhythm problems, it's because they have a genetic predisposition toward it. So these are two internal things that happen biologically, chemically, within the neurons of the brain that regulate the sleep. So it's important to understand these two things because understanding these two things can help give us more control over sleep. If we know that caffeine interferes with sleep, then we can change our behavior in regard to caffeine. If we know that napping interferes with sleep, then we can change our behavior in regard to napping during the day. If we know that light interferes with sleep, then we can regulate how much light we're getting at different points of the day to try to encourage us to go to sleep. So this is a little graphic that shows how these two internal systems work. At the top, if you look in the left-hand corner, that's the homeostatic sleep drive. So as you move across the page, you see these white arrows that are pointing down. And as we go from 9 a.m. to 3 p.m. to 9 p.m., those arrows are getting longer and longer and longer. So this is to represent that the homeostatic sleep drive is getting stronger as the day goes on because we've been awake longer and longer, hour by hour. Then once we fall asleep, if you look down at the bottom, we fall asleep maybe around 10 o'clock on that graphic there. After we fall asleep, those arrows start to shorten because now the homeostatic sleep drive is decreasing because we're sleeping. It's telling us we're asleep. So it gets shorter and shorter and shorter throughout the night as we get closer to the morning and we're ready to wake. At the bottom is the circadian rhythm. And this, again, is affected by light. These are the yellow arrows on the bottom. And we see that as the day goes on, those get longer and longer too. The little sun is on the left, the day goes on, the circadian alerting signal gets stronger and stronger. And then at the pinnacle, the circadian alerting rhythm is really high, and the homeostatic sleep drive is really high. When both are at their highest point, this is when we fall asleep. And then both of those start to taper off throughout the night as we sleep. You can see there's also a little graphic here for melatonin. This is one of the chemicals that causes us to sleep. This is often recommended by physicians to take and people in popular culture to take as well to try to get yourself to go to sleep. The melatonin levels in your brain get higher throughout the night as you're sleeping. And then as it's time to wake up, these get lower. So melatonin is another chemical that affects sleep. So how much sleep do we need? It varies depending upon how old we are. So when we're newborns, we need a heck of a lot of sleep. We sleep anywhere from 14 and 17 hours. Then when we're kids, we sleep anywhere from 7 to 9 hours. And then when we're adults, we need about 7 to 9 hours too. As we get older, we sleep less and less and less, and the quality of our sleep decreases also. And this is because the brain gets less efficient at sleeping. That suprachiasmatic nucleus and the circadian rhythm start to become less efficient in the way they work. So our sleep becomes lighter. Our sleep becomes lighter. It's easier to wake us up. So then subsequently, the quality of our sleep decreases as we age as well. In general, people are not getting as much sleep as they need. So for the average adult, if you need 7 to 9 hours, you know, sometimes people get 6, sometimes people get 7, sort of at the bottom of that range. So we're feeling fatigued. As we get older and our sleep becomes less efficient, we start to feel fatigued too, because we might be getting more sleep because maybe we have more time to sleep, but it's not as high as quality. So we end up feeling fatigued throughout the day there too. These are the stages of sleep. A lot of people are curious about what the stages of sleep are. There are 4 stages. There's 2 light stages and 2 deeper stages. So the light stages are stage 1 and stage 2. The deeper stages are stage 3 and stage 4. The other term for stage 4 is called REM sleep. And REM is an abbreviation for rapid eye movement sleep. What we really need to feel rested is a lot of stage 3 and a lot of stage 4. And these occur later because we got to go through 1 and 2 first. So if something interrupts us when we're at stage 1, we go back to stage 1. If something interrupts us when we're at stage 2, we go back to stage 1. So if we're interrupted by, say, steroids, which are a huge problem for people with cancer sleeping, it's really hard to go from 1 to 2 to 3 to 4. So you're not getting a lot of that deeper restful sleep. If you're interrupted by pain, which is a big part of cancer life too, it's hard to go from stage 1 to 2 to 3 to 4. If you're interrupted by your bladder because you have to get up in the middle of the night, again, it's hard to get to these later stages of sleep. So things that interfere with sleep tend to get us in these earlier stages of sleep, and then it's harder to get to the later stages and we're not feeling as well rested. Stage 1 is this transition period between wakefulness and sleep. It lasts around 5 to 10 minutes. Stage 2, your body temperature starts to drop, your heart rate starts to slow. So this is getting your brain more in a regular pattern of sleep wave cycles, and you start to go to sleep, and this lasts about 20 minutes until you finally get to stage 3, which is the deepest level of sleep. Stage 4 actually is not the deepest. Stage 3 is the deepest level of sleep, and this is where your muscles relax, your blood pressure drops, your breathing rate drops, and this is where you get the most physiologically restful sleep. Stage 4, the REM sleep, this is where our dreams happen, and this is where a lot of that learning consolidation happens. So we really need stage 3 and 4 in order to feel rested. As we get older, we get less 3 and less 4. So this is a natural part of aging as well. So this contributes to memory problems. This contributes to fatigue too. Little babies and little kids, they get a lot of 3, they get a lot of REM because their brains are developing rapidly, and that's why they sleep well. So there are lots of things that interfere with sleep. Some of them are chemical, some of them are behavioral, and some of them are psychological. So one of the biggest things that psychologically interferes with sleep are negative beliefs about sleep. If we think of ourselves as poor sleepers, if we think of ourselves as people that don't sleep well, can't get to sleep, have a lot of trouble with sleep, those beliefs tend to lead us to sleep poorly. Because if we think we don't sleep well, I'm going to have difficulty the next day, I'm going to be tired, I'm not going to be able to think straight, I'm not going to be able to function, this starts to make us feel anxious. And when we start to feel the emotion of anxiety, This revs up this fight or flight system in our body. So our heart rate increases, our muscles tense up, our breathing becomes more shallow, our thoughts start to race. And this is the opposite of sleep, right? Because when one of those deeper stages of sleep, as we progress from wakefulness to good quality deep sleep, our muscles are relaxing, our heart rate is slowing, our breathing is becoming deeper, and our thoughts are slowing down, and they're starting to move into these soothing brain waves of sleepiness. So if we have negative thoughts about sleep, this functions to keep us awake. Another thing that interferes with it are poor environmental conditions. So these are very simple things that make you uncomfortable. If your room is too hot, if it's too cold, if your mattress doesn't feel good, if your sheets and your pillow don't feel good. A big thing here with poor environmental conditions, probably the most common one I encounter, are pets. People with pets in the bed that wake them up because they're moving, or because they're barking if they're dogs, or they're walking on their face, or this and that and the other thing. Pets getting up during the night, that serves as a poor environmental condition that interferes with sleep. The third thing are problematic learning and association. So what is true of sleep is that it's a behavior. It's something that we do, and people don't really think of it as a behavior, but in fact it is, because it is something that we do. And as something that we do, we start to learn how to do it and how not to do it. We start to learn where to do it and where not to do it. So problematic learning, when it comes to sleep problems, a lot of that has to do with laying in bed, being frustrated that you can't fall asleep, worrying about how you're going to function the next day, tossing and turning, feeling stressed, feeling anxious, feeling irritated. What you're doing during all that time you spend in bed not sleeping is you're teaching your brain that lying in bed is frustrating and anxiety provoking and stressful. So we're learning that that certain time of day when we're supposed to be in sleep, in this bed, in this bedroom, is stressful. So that this is not conducive to sleep. As we learn that association between being stressed out in bed, being stressed out at night, being stressed out in the bedroom, we're not going to sleep well. On the other hand, we can also learn to sleep well in other areas. So if we sleep in chairs during the day at 3 p.m., then we're learning that we can sleep in chairs during the day at 3 p.m. so that we're contributing to napping. So this is a problematic learning association too. So, the bad news is all of this learning causes sleep difficulties. The good news is if you learn the bad habits, you can reverse them and learn good habits too. So this is something that we can take action on. Other sleep interference is interrupted homeostatic drive. And that's the fancy way of saying when you take a nap during the day, it interrupts that homeostatic drive. It clears out that adenosine. It resets the clock in your mind as to how long you've been awake, and then it's harder to sleep later. Those of us who have to go to work on Monday will understand the circadian rhythm disruption. Like it's often difficult to sleep on Sunday night, and this is because we went to bed a little bit later on Friday, we went to bed a little bit later on Saturday, and now it's hard to go to sleep at our regular bedtime on Sunday. And then the last thing that interferes with sleep are medications. All sorts of medications interfere with sleep, especially cancer-related medications, the big one being any kind of steroid. Illness, when you're not feeling well physically, you may feel really drained, you may feel really fatigued, but this doesn't necessarily mean that you sleep well. And the other big thing that interferes with it is pain. If you're feeling physically uncomfortable, it's hard to sleep. So talking about insomnia a little bit. So insomnia is a clinical disorder. So to be diagnosed with insomnia, you have to have persistent difficulty staying asleep at least 3 nights weekly for at least 3 months. And that this results in distress and impairment in important areas of functioning. So one bad night of sleep is not insomnia. Even a week of poor sleep is not insomnia. But if you have persistent sleep difficulty for 3 months, that's kind of the clinical timing cutoff for what insomnia is. So what we do for insomnia is first line is cognitive behavioral therapy for insomnia. We call this CBTI for short. And this focuses on the following areas. The first, we give people sleep education, teach them about sleep and how it works so that we can make changes to how we think about sleep and what we do about sleep to try to reduce the insomnia. And as part of that education, we talk about sleep hygiene. So I'm going to talk about that in a minute. But these are healthy behaviors, clean, healthy behaviors that you can do to help promote sleep. We work on stimulus control, which is part of that as well. We're doing things that help to promote sleep rather than disrupt sleep. We work on trying to get your sleep consolidated into a good solid 1 hour, 2 hours, 3 hours, and then grow that out from there. And we teach relaxation strategies, which we'll use today to try to help improve the sleep onset. Medications that are commonly prescribed for insomnia and sleep problems are benzodiazepines. So examples of those are Xanax, Ativan. So those are commonly prescribed by some doctors. There are also Z drugs. An example of that is Ambien. So Ambien is probably the most popular one out there. And then melatonin, which is something that you can get over the counter. So here are the rules for good sleep hygiene. Sleep only as much as needed to feel rested. So sometimes people who are struggling with depression are sleeping more than what they need to feel rested. And this is contributing to insomnia at night, and this is contributing to the depression. So kind of know, and this is a difficult thing to know, especially when you're not feeling well and you have cancer, you know how much sleep you need. So somebody who's actively going through radiation therapy or chemotherapy, if it's your week on for chemo or this is your week for radiation, you're gonna need more sleep than you would on a time when you're not going through those particular types of therapies. So get a good idea of what you need and make sure that you have time to do that. You need to have a routine wake-up time 7 days per week. So changing up your wake-up times and changing up your sleep times interferes with the whole healthy sleep process. So if we go into bed at a different time on Friday and on Saturday and on Sunday, it's really hard to get good quality, consistent sleep. So you need to have a routine. You need to keep your bedroom comfortable and free from light and noise. Light impacts the circadian rhythm, so you shouldn't have any light in the bedroom. So the big violations here are televisions in the bedroom and iPads and phones in the bedroom, because those emit blue light, which serves to keep you awake. We want to learn to sleep in the bedroom and in the bed. So you should only be using your bedroom and your bed for sleeping and sexual activity. If you're doing anything else in there, you're teaching your brain to do that in the bed rather than sleep. You want to avoid caffeine 4 to 6 hours before bedtime. For some people, they actually need more than that. Everyone's different in how they metabolize caffeine, but the rule of thumb is 4 to 6 hours. You want to avoid nicotine before bedtime because nicotine is a stimulant, so that interferes with sleep. And you want to avoid alcohol after dinner. People think that alcohol helps with sleep because it's a depressant biochemically. It serves to slow the brain and kind of shut it down. But the flip side of that is that alcohol gets metabolized by the body. So when it gets metabolized, now that's waking us up. So having that alcohol actually interferes with sleep if you drink it too late in the day. You want to use sleep medication sparingly because it does become less effective over time the longer you use it and the more you use it. So if you are going to use sleep medication, you want to combine it with healthy sleep behavior, like all these sleep hygiene suggestions. Exercise, which is why this is part of this series, is really good for sleep. If you can exercise during the day, it helps to fatigue you physically, rather than mentally, and being fatigued physically, if your muscles are tired, if your heart has had a workout, if your lungs has had a workout, the exercise has cleared a lot of those metabolic byproducts out of your brain, so it helps you to sleep well at night. You want to avoid napping. You want to avoid eating too much food near bedtime, especially things with sugar and especially things with caffeine. So that really includes chocolate, because most things with chocolate have caffeine and sugar. Chocolate itself has caffeine in it. So if you are hungry or accustomed to eating at bedtime, make sure you eat something light. You want to avoid excessive liquids because this fills the bladder and this wakes you up and interferes with those stages of sleep. And you want to not to try to fall asleep, because the harder you try to fall asleep, the less likely it is that you're gonna sleep, because you're like, I gotta sleep, I gotta sleep, I gotta sleep, I gotta sleep. You're amping yourself up. So don't try too hard to fall asleep. The rule of thumb is if you've been laying in bed for more than 15 minutes and you haven't fallen asleep, you should get up and do something else. Get up out of your bed. You're not falling asleep. You don't want to be frustrated in bed because this interferes with your ability to sleep there. So go and read a book or do something relaxing with a low soft light. And then when you feel like, okay, I'm tired, I could go to sleep, give it another try. This also helps you not to do the last one, which is don't worry or spend time awake in bed, because that's teaching you to stay awake. So we got 15 minutes left. So I want to leave at least 10 minutes for the relaxation. I'd like to do that last. So if we have any questions now, we can talk about those for the next 5 or 6 minutes.